So for my interprofessional shadowing experience, I shadowed a CRNA. We were at UK Chandler's H Pavilion OR, and I got to see two different surgeries. One was a sacral abscess debulkation, and the other was the beginning of a cholecystectomy. And very interesting because they both had both patients were obese, and that created problems with the anesthesia. And I got to learn a lot about how you manage the anesthesia, as well as what kind of complications you can face. It was interesting to see how the surgical team worked and how much they had to communicate with each other about when the start time of the surgery was, what kind of medications were going into the patient, make sure they have all their allergies correct, and also getting to see kind of how they had to work together, especially with obese patients, positioning them into their correct positions. And she also taught me about nursing school, CRNA school, how you have to, essentially, you can't work while you're there, and just how competitive it really is to get in. And once you're in, it's hard, but it's that good kind of hard you get with nursing school. Again, similar to our environment. What else? It was interesting to see how they had to communicate not with each other, but also communicating with different areas in the hospital, like the pre-op and post-op, making sure they had all the information relevant to that, to their patients. With that, the first surgery I saw, they didn't do an extensive timeout, which is procedure, but at the same time they were trying to hurry up because the patient they had did not do so well under anesthesia, and they wanted to keep the anesthesia minimal. And so that was interesting to see. It was kind of surprising to see that she wasn't being managed by a doctor all the time, per se. He would oversee her patients, talk to the patients, but then she did have full range during surgery, and if needed, she could call him in and get help, which is interesting. I don't think there's anything else that was memorable from that.